I'm Brett Wakefield. I'm a cardiothoracic anesthesiologist and intensivist here at Cleveland Clinic, and I take particular interest in extracorporeal membrane oxygenation, or ECMO, and mechanical circulatory support, or MCS. ECMO is a life support technology that involves taking blood out of the body, pumping it through an oxygenator to oxygenate the blood and remove carbon dioxide, and returning the oxygenated blood back to either the patient's venous system for veno-venous ECMO or arterial system for veno-arterial ECMO. This allows us to take over the work for the heart and lung during cardiac and respiratory failure. Mechanical circulatory support may be required in patients with cardiac failure and involves a myriad of devices, including veno-arterial ECMO, percutaneous microaxial flow devices, durable left ventricular assist devices, and more. ECMO and MCS are becoming more common throughout the years and require highly specialized training. We wanted to put together a course to allow our Cleveland Clinic caregivers to feel more comfortable providing care for these complex patients. I remember during my training we had an event with a very sick ECMO patient. Right before we started rounding, the machine just turned off. All support stopped. As we rushed to the bedside to get ready to code this patient, I remember the look on my attending's face. He knew if we didn't get ECMO restarted, this patient wasn't going to survive. And I could tell he didn't know how to get it restarted. Luckily, our ECMO specialist was able to come in and get everything fixed just as the patient was about to code, and the patient did okay. But I will always remember the look on my attending's face, and I decided I never wanted to be in that position. That event is what really cemented my interest in ECMO, and particularly ECMO education. I don't want any of my trainees to feel helpless in the CVICU taking care of these sick patients. So with the support of our institute and our perfusion group, we put together a 3-day course covering the important concepts and skills needed to form a strong base in ECMO and MCS management. The course starts with a My Learning module. This module includes ECMO and MCS resources in addition to a pretest. Given the highly specialized nature of the devices, we had to include a significant lecture portion of the course during the first 2 days. This is balanced with hands-on workshops in the afternoon. Considering we use multiple ECMO and MCS devices here at Cleveland Clinic, our company representatives came to offer some time with our devices to allow a hands-on experience for the learners to get more comfortable with this often daunting technology. On the final day, we met in the simulation center. The day started with a pre-brief discussing the plan for the day. We split our group of 25 learners into 5 groups of 5. Each group spent 45 minutes in each simulation. These simulations were very involved, very hands-on. There was an ECMO circuit in each room, a mannequin in each room, vitals in each room. The sims went over a multitude of ECMO complications and disasters and how to manage them. Following each simulation, the individual groups debriefed over their own sessions. After the simulation sessions, we met for a large group debrief and evaluation, and over the next week, the participants took a post-test. The feedback was overwhelmingly positive. The simulation sessions were the highlight of the course, and every participant felt better taking care of these complex patients.